medyo exciting ang pag-uusapan natin ngayong gabi, and we're not talking about, yung pinaka-bulk na medicine as in yung ating specialty. So, iba ito, no? So, it's more of looking at where we were before and then how we came up kung ano tayo ngayon. Okay? Meron bang time na sumuko kayo? Well, during residency, during your training times?
Ako meron.
Talaga?
Meron kasing sobrang hirap nung case, ng mga 3 to 4 months na namin siyang ina-admit, tapos i-discharge, admit, discharge. Medyo complicated talaga yung case. So, talagang umiyak na ako sa training officer ko. Naalala ni doktor yun eh. Hindi ko naman siya kinikibo. Mga ilang oras na rin. Wala na nga luha lumalabas eh, kasi nga talagang pagod na rin ako umiyak. Pero, naisip kong umuwi, no? So, uwi dapat ako. Tawag lang sa daddy ko. Daddy, uwi na ako. Sige, sunduin na kita. Tapos after 1 minute, tawag ulit ako sa kanya. Daddy, hindi pala pwede. Duty ako. So, alam mo yun, kahit na gusto mo nang sumuko, naiisip mo pa rin lagi yung pasyente. Kasi ikaw pa rin ang responsible for them. So, isi-set aside mo lahat ng hirap mo. Kasi nga, alam mo yung responsibility mo sa kanya.
Talagang, it's our commitment, no, to the patient. Ikaw, doktora?
Exact word that I was going to say. When you go into med school, you have to be committed. So even after that, it is important that, you don't give up. I mean, overused word ang resilience, but it's true. You have to be committed to stay as a doctor. So there are times that, you would want to give up. I lost my father first year medicine.
Oh.
It was, it was an eye-opener na even if it was my father who actually egged me on to pursue medicine, even after he left me, I still had that dream. And I was going to pursue that dream and finish medicine specifically because I would want to actually also, we were talking about legacy, parang ako yung legacy na din ng father ko. So, yun yung naisip ko nung time na yun.
Oo nga, no. Naisip ko rin, parang legacy rin is one of the reason also na bakit ako nagtuloy-tuloy. Now, if you're going to ask me, meron ba akong mga obstacle, hindrances? Of course, no? But, yung quitting and, walking out, no, of the responsibility that you have for patients, I never did that. Never. No? First, ganda naman ng ating baka maiyak na tayo.
Ito na nga siya.
We're talking about, our commitment to patient. Is there any specific patient that you will never forget in the entire practice or even during training years that you have?
Madami, pero kasi natuto ka sa kanila. Tapos, buong pangalan pa nga nila, alam mo pa hanggang ngayon. So, yung buong family, kilala mo. Tapos, syempre, hindi naman lahat ng pasyente masasave mo. So, yun yung medyo nakaka-disappoint. Pero, syempre, si Lord lang talaga lahat. Pero syempre, in one way or another, na-touch mo yung life nila. Hindi lahat kasi ng pasyente gagaling. So, pero lahat ng pasyente, maiibsan mo yung kanilang paghihirap.
Ikaw, Dr. Rose.
Actually, madami. But, of course, habang lumalaki yung mga pediatric patients, ang liit-liit lang nila noon, tapos parang hindi magsusurvive, and then nag-survive. All of those unforgettable moments talaga yun. You never really forget your patients, right? Because you develop a special bond with them eh. So, particular patient, parang wala. Of course, there are those na yung hindi agad gumaling, difficult gumaling, or of course, inevitable, pwedeng malose mo yung pasyente. I remember the very first dengue patient na nawala. I cried with the family kasi parang hindi mo ma-describe, parang nakikiisa ka dun sa nafe-feel nila. So, as I said, different feelings, your patient stays with you, right, in your heart, and so, we never really forget.
Yeah, tama. Kaya nga ako rin, I'm still true with what I initially told, yung mga netizens. The reason why I wake up every morning is for the patients, di ba? Kasi kung wala doon yung pagmamahal mo, ay, anytime, pwedeng di na lang ako mag-clinic, alis na lang ako, etc., etc. But, the reason why you have that energy to wake up, get up, prepare, is because you will be seeing these patients of yours. Diba?
May mga pasyenteng na-intubate, nawala ng malay, ganyan. Tapos mga ilang araw silang sa ICU. Tapos ibang-iba itsura nila nung time na sobrang very sick sila. Tapos after a few weeks, pagbalik, gwapo pala tong pasyenteng to, mga ganun. Nakakatuwa kasi from the time na nakita mo sila na sobrang akala mo hindi na mo na lang sila masisave. Tapos lalapit sa sila magpapasalamat yung mga pasyente, yung nanay nila, yung tatay nila, tapos mismong sila. Maganda yung feeling din. Pero syempre, tinatago mo na lang yun na hindi masyadong pero proud na proud ka nga na may natulungan ka.
Actually, the reality is, once you go into a room, tapos the patient is there looking at you, iyon lang nakita niya yung doctor niya eh. Once you form a bond, nakita lang niya yung doctor niya, he'll start feeling well eh. So, I've also noted that with the kids. So, makita lang, of course, with the parents also, pag nakita na nila yung Dr. I, parang it gives them a sense of parang upliftment kahit papaano. Kahit na ganun yung situation, parang, andyan si doctor, hindi niya kami iiwan. So, it gives you a purpose also. Sabi mo nga, di ba, gumigising ka para sa kanila. Kasi nga, you give them hope. Of course, you always tell them, syempre, prayers pa rin talaga. Kasi we don't have the answers to all of the questions. Totoo naman yun eh. Meron mga, di ba, sometimes we say only God knows, which is totoo naman. Medicine is not an exact science. So, we cannot say for sure, this patient is going to survive, this patient is not going to survive, because it all depends on the evolution of the disease itself. So, hindi natin masasabi yun, right?
Oo nga, ako rin, naisip ko rin, marami akong hindi makakalimutan yung tama yung sinabi mo. Pero meron din ako mga patient that hindi nag-survive, but the gratitude of the relatives really boost kasi sometimes you lose confidence. How come you did everything and still, hindi, the outcome is not good, no? Pero at the end of the day, no, if that happens, yung relatives, yung gratefulness nila for you being there for their family, never left them, and you did everything, malaking bagay din. And hindi yung boost ng confidence, but, it tells you that you're doing the right thing. You are on the right track. You are doing what you're supposed to do. Diba?
Meron tayong tinatawag, Dr. Cindy, na good patient care. Nakakatuwa yun, good patient care. Tawag namin yun, GPC.
Yeah, good
May isa akong
patient.
pasyente, residente lang ako noon first year. Parang 1/4 na sako ng sibuyas na pula. Aba, proud na proud akong pinauwi ko yun sa bahay kasi nga, yun yung GCP or good patient care nang galing sa isang pasyente na dinayalisis namin, pinagpuyatan ko yun nung gabi para ma-save yung patient.
Galing.
Oo, sa government hospital, meron din ako mga pasyente nagdadala ng isda na galing dun sa pinebenta nila. And, I appreciate that kasi kahit yung little things talaga, right? They're really the ones that matter eh. Kasi dun mo lang talaga mafe-feel na they're really grateful for what you're doing for their kids.
Totoo. So, ang dami talagang mababait na tao. So, we already realized for the longest time of our purpose, why we become doctors. Somehow, we were able to express our feelings, the things that we have in our minds, especially talking about why we are here as physicians, di ba? So, kung kayo ay in your younger self, anong sasabihin mo sa sarili mo ngayon?
Ako, you got this.
Ay, ganda. You got it.
Yes. Kasi medicine, nung time natin, talagang mahirap naman talaga siya. Right? It's a very difficult course. And I'm sure the medical students who are actually listening, they know how difficult it is to get through it. And all I want to say is, you got this. You want to be a doctor? There are countries na kulang na ng mga doctors ngayon. Right? Like sa South Korea, and there are other countries na talagang kulang ang doktor. So, you are badly needed. Kailangan natin magkaroon ng more doctors. And the reason why we're teaching also is because we want to produce more good doctors in the future. Because parang ang succession planning yan. Pagdating ng panahon, dapat somebody's going to carry the torch.
Yes.
For us, right?
Yeah.
So, yun. Kaya you got this.
Wow. You all got this.
One day at a time.
Nice.
Sabihin ko
Ganda
sarili ko.
rin.
Kasi even if hindi na ako nagtitrain, araw-araw, one day at a time. Di ba? Hindi natin alam what's gonna happen to us tomorrow, sa isang araw, o hours lang. So, we take it one day at a time. Make everything count. Every minute count.
Siguro ako, ang sasabihin ko, job well done, 'di ba? Sasabihin ko sa sarili ko, ay galing mo, winner ka. Pero to those aspiring to be doctors who are already in the field, sasabihin ko lang it's all worth it. Because this is what we wanted to do from the very start. Sabi nga namin, it's commitment, no, to our patient. Our passion of healing, the gratitude that we have, it's not a simple journey, di ba? We have gone through a lot and yet we have this love, patience, resilience through time. So siguro naman as doctors, as people, as a person, no? Hindi namin gagawin ito para dun lang, para for nothing, di ba? So it means it is really inherent in us to really give this back to the patients that we care about. So it's all worth it, no? Hindi yung monetary satisfaction that we have. It is not the power, the popularity that we gain, 'di ba? But it is the feeling of people appreciating what you have done and the gratitude that you have to people that appreciates you, no? In all the things that you do for them, 'di ba? Any last words?
Ako, there are a lot of bumps along the way of being a doctor. But more important than that, you're supposed to focus on the end goal, right? And if you want to be a doctor because of a noble purpose in life, then by all means, right? Even with the bumps, even with getting lost along the way, you just focus on what you're supposed to achieve.
So clear purpose, and at the same time, pray that you will have the health, the wealth, the support of your family, so that your dream to become a doctor will be fulfilled.
So it's a wrap. So this is how we fell in love with medicine. So thank you very much, Dr. Rose and Julie. Nako, it's truly a very memorable day today because we were not really talking about medicine, pulmonary medicine, nephrology, wala yan, but more of our personal journey in medicine. And I hope we were able to inspire our young colleagues there who are studying medicine or in the middle of their crossroads of going into residency, etc. Sana you are enlightened. Thank you, my dear friends, for always having my back. So sana hindi ito ang huli. And don't forget, click the notification bell, like, subscribe, and see you soon.